opportunities, networking, mentorship, and providing resources for small businesses. That's a virtual meeting. It's open to the public, and you can register at roadwork.nola.gov. That's roadwork.nola.gov. It is a virtual conference open to the entire public, and that's for 1 o'clock tomorrow. Also want to remind people on Christmas tree recycling. The city's Christmas tree recycling program is active and moving this year. The goal, as always, is to restore and help protect the coastline. Residents are asked now to place your trees curbside before 5 a.m. on your pickup day for this week. So the week of the 10th through the 15th, whatever your pickup day is, please get your tree to the curb before 5 a.m. so it can be collected. Properties that are in the French Quarter or the DDD, if you're serviced by Empire Services, those trees should go curbside before 4 a.m. on Thursday. And again, a note that we do every year, they only accept natural, unflocked trees that are free of stands and trimming. So take the stuff off the tree before you put it on the curb, please. Lastly is an announcement, and then we'll move into the COVID update. PCAB applications. The City of New Orleans and the New Orleans Police Department have announced open enrollment for the Police Community Advisory Board, PCAB, PCAB membership. Open enrollment officially began yesterday for the PCAB advisory group citywide. Membership is open to any New Orleans resident who is 18 years or older and interested in serving as a volunteer leader in your police district. For more information or to apply, you can go to nola.gov/PCAB. So from that, I'm going to move into a quick COVID update, and then we'll hand it over to Dr. Avegno. As of yesterday, there have been a total of 69,534 cases and 1,016 deaths. The average number of daily cases is over 1,200 right now, and the positivity rate is at 31.7%. These numbers are cause for significant concern, and Dr. Avegno will go more into that in a minute. We are aware that we're seeing a severe outbreak right now. We need everyone to do their part, as we have said all along. What happens next depends on what we do right now. That means masking up. That means getting your vaccination and getting boosted. Right now, and again, Dr. Avegno will go into this in greater detail, but our healthcare services are under tremendous strain. Primarily, that is from unvaccinated individuals who have now been hospitalized with this latest outbreak of COVID. So we urge everyone who's hearing this, please get vaccinated, please get boosted, please do everything you can to stay safe. The way we move forward, the way we get to Mardi Gras, the way we get to what's next is dependent on what we do right now. And that means masking up and vaccinating. And with that, without further ado, I'll turn it over to Dr. Avegno.
Can I ask a clarifying question on trees? It's your garbage day, not your recycling day.
Correct.
But
Yes.
you put trees out. That was confusing in my house. So, hi everybody. Happy New Year. As you just heard Bo said, and certainly all of you know this, our COVID-19 cases have significantly increased in Orleans Parish in the past month due to the Omicron variant, which is more contagious than previous strains and the dominant variant nationwide in a very, very quick period of time. To flesh out some of Bo's statistics, our current average daily number of cases is 1,233. That is nearly 3 times the previous record of April 2020, and that does not reflect home tests because those generally don't get reported to the state. The percent positivity of over 30% is occurring when we have a lot of testing going on. It is not that we have insufficient testing. We have lots of testing. That's just how widespread the disease is. We know we need more testing, and I'll talk about that in a second. We know that although we do have PCR tests, the supply of rapid tests both here and nationwide is very, very limited at a time we need it the most. So it does appear to be the case that overall, Omicron causes milder disease if you're vaccinated and boosted. That does not mean, though, that our healthcare system is able to care for everyone who needs it. What is going on in hospitals right now is anything but mild. In 3 weeks, hospitalizations have risen statewide by a factor of 7. That is a faster rise than in the Delta surge. So I want to make it very, very clear as how quickly hospitalizations are rising. Most people in the community, I would dare say all people, are affected in some way right now by Omicron. So maybe your child is out on quarantine or they're in virtual school. Maybe your favorite restaurant is short-staffed or had to close. Maybe you're working remotely. Maybe your grocery store is strangely out of items that doesn't really make a whole lot of sense. That's frustrating. It's inconvenient. to say the least, for all of us. But I don't think people realize what hospitals look like right now is dramatically different from a mild inconvenience because of staff shortages, EMS delays and long wait times, and large numbers of individuals seeking care, whether it's for a COVID test, whether it's for their heart attack, whether it's for pneumonia, whatever it's for, there are no beds. If you go to an emergency department right now, expect to wait 6, 10, 12 hours to be seen just to get back to the emergency department. We are having staff outages in the triple digits. That's common at some of our larger facilities. Patients, in some cases, are lined up in the hallways. And I will tell you, for me personally, that's really difficult to see. This is something that used to happen when I trained at Charity Hospital. It was not appropriate then, and we knew it. It's not appropriate now. I don't think any of us would want a family member to be treated in the hallway or sitting in a waiting room. Pediatric hospitalizations, particularly in those too young to be vaccinated, are also rising quickly. And so to many of us who day in, day out are in the healthcare system, this is a horrible loop that we find ourselves in again and again with what seems to be fewer resources, fewer attention, and fewer concern in general. And our schools are also stretched to their limits, right? Two bedrocks of any thriving community, hospitals and schools. I can't commend NOLA Public Schools enough for their dedication to families and staff and their dedication to layered mitigation measures, vaccinations, masking, and widespread testing. They have led on all of these things. Because they're doing such high numbers of tests, they're able to break chains of transmission and help us understand just how staggering the spread is. I think many of you saw they reported, I believe, around 2,300 cases. That's 4 or 5 times the highest. And it is every school in the city. But they're doing it and they're catching people early. Many schools have had to go virtual due to widespread staff outages and kids as well, which is not ideal for education, not ideal for the future society. I want to commend them for doing this because if you're not testing, then you're ignoring what's happening and it just perpetuates the spread. So we all want our children to be in person for learning. We all want our businesses to stay open. We all want to throw open the doors of the city to thousands of visitors to dance in the streets. But if that's to be the case, we have to double down like never before on the mitigation measures that work, and that's vaccination, masks, and tests. So one of our most important goals is that everyone 5 years and older gets fully vaccinated and receives a booster dose if they're eligible as quickly as possible to reduce the severity of the impact, to keep them out of being hospitalized for COVID. The vaccines that were effective against earlier strains continue to work very, very well by reducing hospitalizations and deaths with a booster. We're moving very close to the understanding that really this is a 3-vaccine series, and so we all have to just sort of be there. You are far more likely to end up in a hospital if you are unvaccinated, again, by orders of magnitude. But a single layer of mitigation has always been insufficient to stem surges, and we need more than vaccines. Given that there continues to be substantial transmission of COVID-19 and the continued risk of overwhelming hospitals and disrupting schools, the City of New Orleans is reinstating the indoor mask mandate at all indoor spaces, including schools, which most of ours, thank goodness, have already adopted, effective tomorrow at 6 a.m. and will remain in place until further notice. We strongly recommend a high-quality mask, and by that I mean a surgical mask, KN95 or N95, to provide the most robust protection. Once again, we're continuing our partnership with the public library regional branches. We'll get information about that to you. We are dropping off thousands more KN95 masks for public distribution. We are internally grateful to our librarians for supporting this. And so if you don't have a KN95, there's going to be 6 locations, as there were around the holidays, where you can pick one up. So more information on that. Other major cities, New York City, Boston, Chicago, several others have already taken these steps of requiring masks and vaccines, so we are in no way alone. But we are at risk in a way that no other city is because of the large gatherings that loom on the calendar. Even if our cases begin to decline in the next week or two, and I believe that that's likely, I'm hopeful, hospitalizations and deaths will lag likely through at least the next month. And that's right up to the time in which individuals from areas with lower vaccination rates and later Omicron surges may be at our doorstep. We did not know the consequences of this 2 years ago. We certainly know them now, and it would be irresponsible not to act. In terms of testing supply remains a concern, and again should cause us to act with caution right now. We're awaiting, for the past month, we have been awaiting a large shipment of at-home tests coming through the state. The state has been waiting for theirs. We're still unsure as to when we might receive it for wide distribution. This is coming from the federal government. I'm being told that it's looking good for this week, but again, we don't have a lot of guarantees. Fighting this virus without sufficient testing and without putting your mask on is like being blindfolded with one hand behind your back. It is not an ideal way to do it. So until we can get those at-home tests to you, until the ones that are being shipped directly to pharmacies are abundant, please, if you feel sick or have had a significant exposure, take it seriously. That tickle in your throat is not allergies. That fever is not strep throat. It is almost certainly COVID. Isolate until you can get a test or until you have passed what a period of isolation and quarantine would be. So none of this is new. We've done this in far more difficult things successfully before. You know, a major reason why our COVID-19 death rate is lower than most other areas in our state and many other regions in this country, despite our initial world hotspot status, is because we do come together as a community. And so I know that we can do it this time. We're going to continue to follow the data and the science where it leads us. You guys have access to our dashboard, to LDH's dashboard. Everything that we look at is there. And we have to make tough decisions when necessary to protect the health in our community, the health of all of us. This is a simple step, putting masks back on to tackle our biggest problem. So thank you. I'm happy to take questions, whatever.
All right, great. I'm just going to, couple more comments on that, and then we'll move to questions. The healthcare system is tremendously strained right now. Everybody out there, you know a doctor, you know a nurse, you know an EMT, you know a paramedic, you know somebody who is doing this for a living, who is on the front lines. They are not okay right now. They have been in tremendous strain for a tremendous period of time, and the best thing that we can do to help them, the people that have been helping us all along, is to mask up, get vaccinated, and get boosted. It is not complicated. It is very simple, and it's something that you can do to save lives and to help the people that are trying to help us continue to save lives. So with that, we will move to questions.
Yes, Dr. Avegno, I did have a question for you. Considering that testing is so important, is the city opening any additional testing sites? I think we're doing what, municipal auditorium now and.
UNO. Yeah, and that's our partnership with the National Guard and the state, and we are, again, grateful that they have extended their mission time and time and time again. You know, PCR tests are not so much in short supply. So we do have, those are the kind of sites, generally, those are the sites that we're talking about. That being said, staff additional sites is very difficult. So if you look on the NOLA Ready calendar, there are multiple other sites, and those have not run out of tests. You know, my husband and daughter went to one on Friday. They had, you know, they were kind of in and out in 20, 30 minutes. What PCR tests are helpful, but unfortunately, because of the nationwide surge, the turnaround times are longer and longer. So it's 3 and 4 days. That's not helpful, right? That's not helpful when you're trying to sort through the quarantine guidelines in 5 days and 7 days and 10 days and all that. That's why we're really focusing on getting the at-home tests as quickly as possible. Again, as I said, we put an order of tens of thousands. You know, when those hit our doors, we are going to distribute them as widely as we can to the community, because that's what those tests allow people to know, am I infectious, am I not infectious? And they also take 15 minutes rather than 3 days. And so they take people out of like, well, I'm waiting for my PCR test, guess I'll go to the grocery store, guess I'll go to the office, right? So that's what we're really focusing on. I would love to say, yes, we can open more sites. The sites we have are well served and are working. They're just not exactly the full package of what we need right now.
Doctor, as you know, just across the parish line in Jefferson Parish, Little Rascals has decided not to roll this year because of the number of children that I believe have come down with COVID.
harbinger of what to expect during the carnival season here in New Orleans as well? Or do you expect this latest surge to peak before we hit really the crux of the Mardi Gras season?
Yeah, if my crystal ball ever worked, I certainly would have done some things differently. So no, I appreciate you asking that question. Here is what we know, right? So it is likely, because New Orleans is one of the first cities to have the Omicron surge. Very, very similar to us having the first surge. New Orleans, New York, a couple of other cities. The rest of the country is probably a few weeks behind us. So it is likely that, yes, we will peak in cases in the next few weeks. Hospitalizations will lag. So by mid to end February, I don't expect that we'll be in the level that we are now. But for those of you who've never been in the healthcare system around Carnival, let me tell you what that's like, being an ER doc who's a veteran of many, many Carnival seasons. EMS volume goes up significantly just for normal Carnival stuff, because you get hit in the head with a bead, or you trip on the sidewalks, or you have overindulged, or you do things that you do in New Orleans. So I don't believe that our caseload, our hospitalization levels will come back to that lovely valley we were in October, November, December. At the same time, if folks come and do the normal things that folks come at Carnival, we're going to be starting off at a much higher threshold. And so that's why it behooves us right now to take every step we can to get as far down to normal as we can, so that we can handle the usual surge, non-COVID, but Carnival surge. And I think we've all got to be very mindful of this. You know, I think the goal here is to protect our kids, to protect schools, to protect healthcare workers, to protect the system. Shouldn't matter whether or not we're having a party in March. But if people need extra motivation, maybe that's what, they'll find.
Some of the medical experts have talked about that Mardi Gras may be problematic because of the amount of COVID out there. What is your hunch? What do you say about Mardi Gras season in terms of public health?
Yeah, I mean, I think that it's easy to draw comparisons with 2 years ago, although we have a lot more knowledge and tools, right? We have a highly vaccinated city. We have a vaccine mandate. We will have a mask mandate. And we have testing. We had none of those things. It's my job to worry about the health of the city. And so I feel like we need to position ourselves to be as healthy as possible. What happened 2 years ago, I think, is very different. I think we are in a much better place than that. But I do think we all have to understand our own risk tolerance and what we believe is important as a community, and make decisions accordingly.
WDSU and Dan.
I have a couple questions. So it sounded like you just said the mask mandate will last through Carnival.
I mean, that has certainly been my recommendation. And we talked about this. We talked about putting it back on before anyway. So I think it probably doesn't make sense to put it on and take it off. I think we're going to need that layer for some time.
It'll be driven by the data.
Yep.
I don't mean to put you on the spot, but do you have any idea what the current vaccination rate for like 15 to 18 is in New Orleans right now?
That's a good, I don't have it 15 to 18. I can tell you for 5 to 17-year-olds, fully vaccinated is a little over 35%. One dose is close to 50%, I believe. It's all on the dashboard, so I don't want to, it's climbing, and this, the mandate plus the school's mandate, I think by the beginning of February, you're going to see a real jump in those numbers, and that's exactly what we need.
I was going to ask
yeah.
if you're satisfied with that number.
No.
And then if you, what's your message to parents? Because I think through a lot of this pandemic, we've said, oh, it seems like for the most part, kids are okay.
Right.
We're going to have a lot of kids probably going to parades, marching in
Yeah.
parades. What would you say to parents who maybe are still worried about that?
I would say that Children's Hospital right now, as hospitalizations climb, the kids that are hospitalized there are unvaccinated children. Some because they're too young to be vaccinated, and we all know we have a responsibility to surround them with protection. Some because they're old enough, but they haven't chosen to be vaccinated. This is a serious disease. This disease is more serious in many ways than many of the immunizations we get for our children on a regular basis. It's also incredibly safe. We have not had a pediatric death from the vaccine. There have been some rare side effects. They have been transitory. So, and we're talking millions and millions and millions and millions of children. So the evidence is really strong. We've had lots of local pediatricians come and speak out on this. If you know, I always encourage people to talk to your pediatrician. If not, you only have to look to social media. We've got some great pediatricians out there who are really explaining what this looks like for kids. And so, you know, this is, if you want your kid to take place in the festivities, you really have to protect them as best you can.
Do you have anything? Two things. One, just real quick. Did you say effective tomorrow morning at 6?
Yes. Mm-hmm.
Secondly, and I know you get this a lot, and it's difficult to answer because there's no one magic number that results in something like this. But can you please help us, like, walk through your thinking on the timing of this? Because it has been clear for a couple of weeks that Omicron is surging beyond past previous levels, and hospitalizations have been rising at this incredible rate. Why now? Why not earlier?
Yeah, I can only be honest and say it's not perfect timing. It's something that we've been looking at for a while. We knew that the holidays would be sort of a weird time, and we wanted to really make sure we were, I guess, providing a robust response with all the tests and giving away masks. And also, I will say it shouldn't take a mandate to do this. I think those of us in public health who have taken these steps, mandate requirements, we don't like doing those indiscriminately, right? We've been up here since early December saying you got to wear a mask. It's really important to do all these things. And I think, you know, for better or for worse, we sort of always hope that that message is getting across. But when it proves to be insufficient, then you put the mandate, right? You don't necessarily want to do it every time. Yeah, I don't know. I'm struggling to find the right answers for that because I you know, I'm just going to be honest with you.
Sure.
Yeah.
Yeah, no, of course, there's no easy answer on that. But I will say, to elaborate a little bit on what Dr. Avegno said, we've said this all along in terms of enforcement, in terms of what we expect the buy-in from the community to be. The hope has been consistently not to lead with punitive measures, not to lead with harsh tactics, to engage the community because everybody has a role to play in this. We've been saying since, I don't even know how long, that to get to Mardi Gras, we have to get there safely. And we need everybody to be engaged in doing that. Which is to say, is it easy after the fact to say, could it have been earlier, should it have been earlier? Maybe so. But where we are now is it's very clear that the need is there. And that's why we're doing it at this time.
And the question's not so much about, well, like a gotcha question. It's
No, it's not a gotcha.
It's more to help us, like, understand what you are actually thinking as you're making these decisions.
Sure.
You have to do it anew every time, and it's
Right.
helpful
Right.
for the public to understand.
And
Right.
I'll say too, there's always the hope that this would be a statewide mandate because we know that while this has truly helped Orleans when we have had it and had stricter measures, I mean, the proof is absolutely there. It's so much more easier to get buy-in and implement when it is statewide. You know, I think it's at least 8 states now have mask mandates. And I'm not trying to throw the blame on the state, but there's always that hope that could we engage other areas who see the importance of this and kind of all do it together so that it's, you know, not necessarily just us leading, but, you know, at the end of the day, if we've got to do it, we've got to do it.
Box 8 and then associated with.
In regards to pediatric hospitalizations rising, are you seeing this, children going to hospital for COVID pneumonia or other reasons, and then also testing positive?
So it's both. It is more, you know, and I have not seen the latest figures, and Dr. Klein, of course, at Children's is the one to ask about this. But the good news is, both pediatric and adult, we are not seeing ICU utilization as we did in the early days. A lot of that is thanks to our healthcare community because they figured out how to do a lot of this without needing to put people on ventilators, and that's true nationwide. So my understanding of the pediatric hospitalization we're seeing is that there's definitely some who come in for whatever, their appendicitis, their, broken leg, and have a positive COVID test. And we're seeing that in the adult hospitals as well. But a large number of them are coming in for complications with COVID. And again, maybe they're not in the ICU, they're on the floor, but they're still hospitalized. And that's pretty terrifying to a parent. And at the end of the day, it doesn't really matter why you're in a bed. If you're taking up a bed, then that's a bed that somebody sitting in a waiting room can't access. So whether your primary reason is COVID or the fact that you also have COVID and you need extra mitigation while you're in the hospital for your, car accident, a bed is a bed, and we don't have them right now.
And on top of that, real quick, we know that the Omicron symptoms are less severe than previous strains. What would you say to people who say to this mask mandate and the current caseload that we're seeing that it's not any worse than a cold, right? Can you kind of
Yeah.
How do you argue that, or how do you explain
Sure.
that maybe it is?
I can't remember the last time a cold shut down the American healthcare system. And that's what we're seeing. So for you, it might be a cold, but it takes you out of work. It takes 30% of people testing positive out of work, which means our nurses are out of work, which means your elective surgery doesn't get done, which means your kid is on virtual and is not learning as much for the next week. Colds don't do that. Colds don't overwhelm hospitals. And so it's beyond what the effects might be on me and how is it affecting the larger community.
You had a question as well?
Yeah, so, excuse me, is the city looking at any additional measures on top of what's already been done to make people feel safer during Mardi Gras? I mean, you said that there are a lot of people flying in, who might not be from the state, who might not be vaccinated, are there vaccine requirements at the airports, anything?
Yeah, I think, what we're trying to do is put those protective layers over the whole city. So you might be able to come to New Orleans if you're not vaccinated, whether you fly, whether you drive. And again, most people drive, so, having vaccine requirements at the airport isn't really practical for that reason. But you can't do anything when you get here, right? You can't go to a bar, you can't go to a restaurant, you can't go to a concert. You can have a negative test, and that gives us some reasonable assumption that you're not actively infectious. But it's really not, and then you'll have to wear a mask. So if you're unwilling to do that, if for whatever you think that is gonna not, you're not gonna have a good time, then that's your choice. What we're preserving is our health and safety of our residents. So if you can't make those simple choices for us, then, we need to make sure that we're taken care of.
I'll ask you a question, Associated Press, and then back to WWLTV.
Have you seen any, data, is there an increase that is going on with regard to children getting the vaccination? Have you seen clear increases?
Oh, yeah.
And do you have any, I know you usually say 5 to 17-year-olds, is there any information, even anecdotal, for that 5 to 11-year-old group that is?
Yeah, it's hard to break down. The reason why it's hard to break down is that the numbers are not reported. When we get the numbers from LDH, it's reported as 5 to 17. And so we kind of have to guesstimate how many 5 to 11-year-olds currently live in the city of New Orleans. And it's just really hard to make that clean. And we don't want to give bad information. Yes, I will say since the approval for kids, especially sort of the 12 and up, our fastest, every time we get an update on vaccinations, the fastest growing group is kids. Makes sense, right? They've got longer to go. 90 plus, I think it's 92 or 93% of our seniors have already gotten it, right? So there's fewer of them to get it. But the pediatric rates are increasing, quite, again, relative to others, they're increasing at a faster rate. And again, I expect that's going to only pick up. I know that talking to the public schools, they're continuing to have their vaccination efforts. They had so many at one of them the other day that they actually had to reschedule people, which has never happened before. They've always sort of had enough to go around. So I think it's a combination of learning loss, right? Like if my kid's vaccinated and they're exposed, they can come back to school, right? They don't have to stay home. The school mandate, and then people just wanting to protect their kids. I think that's really working. And so I do expect the numbers to go even higher.
I mean, it's about 30% right now.
I think, again, it's on our dashboard. I believe fully vaccinated 5 to 17-year-olds is a little over 35% as of the numbers I got yesterday.
And just to clarify one other question on the mask mandate, at this point, it is expected to be in place during Mardi Gras? during the
Yes.
duration of Mardi Gras, correct?
Yes.
Last few questions, WDC, WGNO, and Foxy.
I know you and I talked a couple weeks ago about Sugar Bowl parade and the Sugar Bowl itself coming up, and you told me at that point you were hoping to analyze data from testing sites around those events to kind of see how that played into kind of where we are now. Were you all able to get any access?
You're reminding me that I've asked for that data, but I haven't gotten it yet. So I'm going to ask again. Thank you. No, I haven't got, I know the sites are very busy, but I'm going to ask again. Thanks.
Dr. Avegno, I already know the answer to this question, but it is the season, so I'll ask. Mardi Gras balls.
They need to wear masks too. Anybody indoors, right? Doesn't matter if you're going to church, grocery store, Mardi Gras ball, school. If you're indoors, you're indoors.
Regarding vaccine mandates, gyms, is that a requirement now? We're seeing.
It's been a requirement, yeah. Been a requirement.
WWL, and last question.
Yeah, for Bo, there's been ongoing discussion with the crew of coach about wanting to start or at least have some presence in nearby Children's Hospital at Henry Clay and Magazine. There was a real impassioned, open letter from a pediatric nurse on the mom's blog talking about how much it meant to her when she was an 11-year-old patient at Children's during Mardi Gras to have this parade come by. Given what this parade does for these kids,
Right.
is there any wiggle room, is there any way that this crew can achieve their mission of cheering these children up during Mardi Gras that they have to stay in?
Right. So let me speak to that. As we've said kind of throughout this, the way that we move forward for Mardi Gras, we do it as safely as we can. And that involves obviously our response to the COVID pandemic, but also having to deal with the very real realities of what our bandwidth is in terms of public safety personnel. The way that we did that for this year, and it's for this year alone, it's not for every year going forward, every route did take a shortening in some way. Now, it's Mardi Gras, and everyone has traditions around Mardi Gras that are very important to them, that are very meaningful to their elements of the community, and we want to respect that wherever we can. That said, every single parade and every single element would have a compelling reason to say, but we don't want to change everybody else, but not us. We can't afford to do that this year. We can't afford to go case by case through every parade and every crew to litigate whether or not there's going to be a change. As of right now, what our public safety resources allow for are the routes that were announced in December, and those are not going to change at present. I would encourage you also to speak with Children's Hospital about this, because I know they've had some conversation in the community around what their expectations are, and certainly they are grateful for the support and the love that TOTH has always shown them, but this year it's just not practical.
Last question.
Yeah, so I know you've been waiting on tests from the federal government, but what about N95 masks? Because there's a lot of data that has been suggesting those are.
Yeah, and that's what we're encouraging, higher levels of masks, and I'm happy to see that many of you guys are already wearing them, surgical KN95 or N95. So again, we do have decent supplies of those. We've actually worked with a community partner to get several tens of thousands to schools so that they could have it there. We have more where that came from. We'll be, again, stocking them at libraries, and we'll have the locations and all that when we do the press release. They're much easier to find. You can go on Amazon and get, the cute color, different color N95s, KN95s, pretty readily. So if you can order some for yourself, that's great. If not, we will keep supplying libraries and looking for other places. We've reached out to other community partners saying if you need masks, let us know. We can get you those. Those are a little bit better supply.
Thank you all.
Thanks a lot, everybody. Appreciate you.
Indoor mask mandate applies to Catholic schools?
It absolutely does.
Yes.
And private schools.